Journey Through Parenthood with Martina Bills.
Brought to you by Southern Ohio Medical Center. Very good things are happening here.
Good Wednesday morning, everyone. I'm Martina Bills. Thanks for joining us here on the WSAZ Now Desk for Journey Through Parenthood. Today we are talking about how to stay positive with children who are dealing with mental health challenges. So as an adult, whether you're the parent, the caregiver, a teacher, there's some ways that you can help this child through their issues with mental health challenges. And I know a lot of students have, kids of all ages have really faced mental health challenges, especially since the COVID-19 pandemic has really changed a lot of things in the last couple of years. So we're talking to Dr. Suzanne Barchers with Lingo Kids, a little bit about how wording can mean something different, the way you phrase things, and then we'll regroup after and talk about it.
To work, what your obligations are, what your goals are. You don't thrive in an environment where it's all unknown or you're just left on your own to kind of figure out, well, today I'll do this, today I'll do that, and maybe they'll have this program or maybe they won't today. That any kind of unnecessary uneasiness, it makes it harder for us to focus and function well and do our best.
Mm-hmm. Okay, let's talk about instilling positivity for kids with mental health challenges, because I know this is something that has come up so much since the pandemic pretty much started in 2020 with how important our mental health is, but also the children's mental health. So if a child is challenged by these mental health issues, where do you really, or how do you really instill the positivity to keep them going?
So I have dealt with that in our family where we've had to work with a child with mental health issues. And I think one of the toughest things is finding the words that resonates with that child and doesn't speak down to them. It recognizes that what they're doing takes more effort to be successful than someone without the mental health challenges. And I think when we say things like, I know what you feel, or I know how you're feeling, well, we probably don't. Mm-hmm. We don't know what's going on with that child necessarily physically or mentally or emotionally. We don't know what is underlying the problem. So we always want to talk to them about it, but they don't always want to talk to us, because it's something that maybe they can't articulate. So I think the role of being that supportive parent who admires and honestly admires the steps that are taken. You made it to school today, and tell me about it. What was the bitter and what was the best? And not lay any judgment on it, but just ask for the conversation. And if the child doesn't want to talk about it, say, I'm available when you're ready. Mm-hmm. And I think these open-ended questions lets the child know you're interested, but that you also respect that it might not be something you can discuss just yet. Mm-hmm. I think having a pet in the family is good if it's possible, because I think taking care of a dog or a cat, something warm and fuzzy that is non-judgmental, can be really helpful. And then also, of course, professional counseling, if that seems warranted. Always enlist the school. See what kind of support you can get through the school. And read. Try and be as knowledgeable as possible about it. Not be so reactive, but be ready to jump in when you sense that there's something really serious. If a child is at risk of suicide or running away or cutting, inappropriate drug usage, all these kinds of things. Unfortunately, we have to be on our guard all the time. Inappropriate friends, inappropriate internet usage. It's tough.
I was going to say, that's a lot of stuff right there. That list goes on and on.
It is. And, you know, it wears down the whole family. And I think this is a time when we draw in all the support systems we can as adults.
And really, when you said being, not judging someone that's having a challenge with something like this, I think that stands out to me when you said, not being judgmental. I think that goes in, so many different aspects of life, whether you're a child or an adult or whatever. But I think that's what a child in this kind of situation kind of needs to know, that they're not being judged.
That's right. And I think to hear an adult say, this is tough, this is hard, we can work together. There are lots of tricks up the sleeves of the caretakers around us and the professionals, but we can make it work better if we can work together. And that's where open communication really helps. I think the other thing that's really important to say to a child is, I had a period in my life where I was despairing. I wasn't good in sports, and I really wanted to be a good basketball player. Or I couldn't get better than a C in math, and it really brought me down. And here's what I did about it. But give examples that are real and true, and don't diminish what the child is going through, because their problem could be far more complex, or be dealing with really difficult social issues.
So that is Dr. Suzanne Barters. She has a PhD in education. She's the Education Advisory Board Chair for Lingo Kids. And I've talked to her quite a few times here for Journey Through Parenthood. And she always has really good insight into different topics. And we're talking about children dealing with mental health challenges, and how you as a parent or guardian or an adult in that child's life can really make a difference. Some of the things, I know she says that it is hard to find the right words, and every child is different, and they really may not be able to articulate what they're dealing with. But if you keep, not questioning them, but making sure they understand that you are, there to make sure they know that you're there for them, and what they're doing in life with the mental health challenges may take more effort than other children. And it's all about the wording, and also that they don't feel that they're being judged. And that can kind of go a long way in different aspects of life, not just dealing with children with mental health challenges. I think that's a good thing to take in as an adult, just as a human being in general, not to make people feel judged. But Dr. Barchers makes sure we all know that, mental health challenges in any family really can weigh down the family. And so, it can have an effect on everyone, other children in the family, other adults in the family. And when it does get too serious, maybe, outside help could be what is necessary, and especially if they're talking about harming themselves. So always good to talk to Dr. Suzanne Barchers, and we want to show you how you can find all these segments on Journey Through Parenthood on the WSAZ, SAZ.com. You can click on this three little lines and then scroll down to Journey Through Parenthood, and all of the segments we've done here on the WSAZ Now Desk are listed here, and you can go back and watch other segments I've done with Dr. Suzanne Barters, or other health professionals, or topics that we've covered here on the WSAZ Now Desk. We are here every Monday and Wednesday at 10 o'clock. We hope you enjoy this Wednesday.